Okay, guys, we're live. It's Saturday, it's not Friday. Facebook Live. And hopefully, some people will jump on and we'll answer some questions. We'll see how it goes. So, if you are jumping on the chat, let me know if you can see me and hear me. And I'll see if I can find myself on here. Looks like there I am. Okay. So, hey, we're live. It's Saturday, it's not Friday. We just came back from Hawaii, so I was kind of tired yesterday. So I'm here answering your questions. People are jumping on. Hey, on Facebook, if you guys are seeing me jumping on, feel free to ask some questions. I'll answer them. You can answer questions too if you want. That's great. As people are jumping on, I'm going to let you know about one new study that I'll probably talk about in more detail in a later video that has to do with the risk of miscarriage with this bad air quality. So there's a study that was just published in a journal called Fertility and Sterility, and that was done at the University of Utah. And they looked at admissions for miscarriage in the 7 days following basically a spike in bad air. And what they saw was that for every 10 parts per billion, every 10 parts per billion increase in nitric oxide, or was it nitric dioxide? It's one of those two. There was like a 16% increased risk of miscarriage. So basically, it's just another study that shows the health consequences of exposure to bad air here in Utah during our inversions. Fortunately, today looks like green, so we're in good shape today. I just checked it before I came on the broadcast, and the air quality is quite good right now, even though it looks kind of dreary outside. It's not from particulate matter, so that's good. So one question that keeps coming up that I keep asking myself, what can I do, to reduce the risk? And a big thing, of course, is don't be outside on days when the air is bad. Try to limit your outdoor exposure during those sort of code yellow and code orange days. Another thing that was suggested by the doctors at the U, who were the authors of the study, was that if you had to be outside, you could potentially reduce your exposure to these particulate matters in the air using what's called an N95 respirator. So you can buy those, I think, at Home Depot. It's basically a air mask that filters these really small particles. It's for a standard surgical mask like you might see people wearing in a hospital, won't do it. So it's not a good enough filter. The particles are too small to be filtered out by that kind of standard surgical mask. So, but if you get an N95, that is a good enough filter to cut down your exposure. So something to keep in mind. Okay, well, hey, Lonnie's jumping on. She's got a question. 19 weeks pregnant, feeling tired, on thyroid medication. What can you do to get some of your energy back? Well, of course, one thing is, we typically monitor thyroid levels fairly frequently in pregnancy, depending on how stable your dose has been, how stable your labs are. We sometimes need to check them even every month, but at least every trimester. So if it's been a minute since you had your thyroid tested, my advice would be check that out. Sorry if you hear the dog bumping around behind me. So that'd be one thing. Get your thyroid tested for sure if it hasn't been tested recently. If it's normal, of course, you can make sure you're not anemic. That's usually done at the initial prenatal labs when you have your first visit, but if it wasn't, you can certainly do that now. If those are both normal, then basically there's not a whole lot more you can do other than just try to rest. Hey, Bethany, how's it going? Hope everybody who's jumping on had a good Christmas. We were in Hawaii, so it was not bad. The weather was pretty nice. And I mentioned it before in one of the videos I did before I left, but I think I did anyway. There's this, would you knock it off? There's this crazy climb that you can do on Haleakala Crater. So you ride from Paia, which is at sea level, up. You can go as high as 10,000 feet to the top of the volcano crater. I did not quite make it to the top. I got a little bonky at about 7,000 feet. So I made it 7,000 feet of the climb, which I was pretty happy with. but maybe if I go back next time, try again. Let's see. Mary had a question. Really bad PMS around your period. What can you do to not be so moody? So there's a few things you can do to reduce PMS type symptoms, particularly when it comes to mood. Some of which are natural, and one of which is medication. So, as far as natural things you can do, there is evidence that aerobic exercise during that premenstrual phase does reduce symptoms. So, doing some sort of aerobic activity, whatever that is for you, may be helpful. So, I would consider that for sure. Probably, doing things that reduce stress otherwise may be helpful to some extent as well. As far as medication goes, there's one medicine that was studied specifically for PMS, and that was, it's basically Prozac. They relabeled it Serafim. It was 10 milligram Prozac that you took during the premenstrual phase, and that was shown to reduce PMS type symptoms substantially. So that's something to consider as well. The nice thing is you only have to take it during the premenstrual phase, so you don't take it all the time. So probably less side effects that way than if you took it every day. So that's something to consider as well if you feel like the symptoms are bad enough. Okay, well, I just saw somebody jump on YouTube with a question. Let's see. From Canada, hello, Liza from Canada. Let's see, taking prenatal vitamin with some calcium, wondering which natural would you recommend if you don't have calcium diet? Yeah, so no one particular calcium supplement is really any better than any other as far as I'm concerned. But about 1,500 milligrams per day is a good number just for anybody, whether pregnant or not. So if a prenatal that you're taking only has 300, then if you wanted to take a little additional supplemental calcium, wouldn't be a bad thing. There's also evidence that vitamin D is good in pregnancy. There's a couple studies that showed less risk of miscarriage and actually less risk of fertility problems if you took about 1,500 international units. That would get you to a therapeutic level over time. So that's something to consider as well. All right, let's see, Bethany, congrats on the climb. Thanks. Yeah, I don't know the Miley Cyrus song, but I'll check it out. It was a long climb. Okay, so let's see. So yeah, thanks, Liza, for your comments from Canada. Cheers. So far, you get the award for watching from the furthest distance anyway. There's a lot of folks jumping on Facebook now, too. So if you're out there watching, let me know where you're watching from. Let me know if you can hear me and see me, if everything seems to be working okay. And is anybody going skiing yet? I think for tomorrow, that's going to be tomorrow, first day of skiing. Okay. Well, nobody's thrown out questions just yet. So still just kind of waiting for those to roll in. While we're waiting on that, let's see. I'll just jump over here to the YouTube channel and see what comments have been popping up lately that might spur some conversation. So let's see. Bear with me just a second. And if you guys have questions, jump in there. Okay. Here we go. So we'll see. Did you just sign in? Yes, I did. Oh, Liza's got a question. Thank you, Liza. I'm having dead air here. Let's see. Another question. Taking vitamin D, omega-3, liquid form, and prenatal. Is there anything else you recommend? No, that really covers it. I mean, I'm assuming your prenatal has folic acid, of course. Most of them do. And assuming it does, then you should be good. And that's really about it. There's no other evidence of any other supplements that are of any particular benefit. Let's see, sciatic pain, all sorts of backache and whatnot. Yeah. So, my theory on pregnancy-related pain specifically is it gets worse every time. So I think you said this was your second baby. It gets worse every time, no question about it. So, but doing exercise that helps strengthen your core, that helps stabilize your sort of lumbosacral area would probably help. A lot of the kind of rotational type stretches are also good. If you Google it, if you go on the American College of Obstetrics and Gynecology, I think they still call themselves a college, maybe it's Congress now, but put acog.org. There's a patient side. There's a pretty good handout on there about back pain and pregnancy that talks about some specific stretches that you could do. So I'd maybe take a look at that. Let's see, got some questions popping in now here on Facebook. Thanks, guys, for your questions. Let's see, Lonnie's got a question about can't take any prenatals without getting super sick. What do you recommend? Yeah, I mean, it's always a tough situation. The most important thing, of course, is trimester. You're already 19 and a half weeks, you mentioned in the comments previously, so I'm not so worried about that for the moment. The second most important thing is iron, which is also the thing that tends to cause the most nausea, I think. Most of the iron supplements are pretty hard on your stomach. So if you notice that your prenatal has iron, then maybe try taking one without iron until you're feeling better. A lot of the gummy ones don't have iron because I think they can't make that work. So maybe you consider trying like a gummy type prenatal until you can't keep anything, until you're feeling better, until you can keep things down. And then maybe go back to just like a normal prenatal vitamin. Okay, let's see. On birth control, wondering what other option is there besides the pill. So there's a lot of options, and I'll kind of hit the highlights, and then I'll tell you that there's a video on my YouTube channel that really goes through this in detail, so I'm just going to pop in that. It's Wes D. Ski. That's a quick way to get there. If you just go to YouTube and search Wes D. Ski, you'll find it. And there's a whole video on there about, I think it's called What Can I Do for Birth Control? Maybe check it out. But, you know, the way that I think about it when I'm talking with people is, you know, basically, do you want something that's daily versus something that's non-daily, and then something hormonal versus not hormonal? That's kind of the simple way to break it down. So daily pretty much is a pill, and obviously that's hormonal. In the non-daily but hormonal options, you've got either any of the IUDs that are not the Paragard. The Paragard's a non-hormonal IUD, but, you know, Mirenas and Liletas and Skyla and Kylena, those are all progesterone-based IUDs, all very effective. They're good for anywhere from 3 to 5 years, depending on the one that you pick. They're all fairly well tolerated and tend to make your periods lighter, which is not a bad thing. And then the non-hormonal, of course, is the Paragard. Good birth control is good for up to 10 years. Can make your periods heavier. That's the main thing that I want to make sure people know, because that could be a drag. And then in the hormonal, non-daily, not IUDs, you've got the Nexplanon, which is a little insert that goes in your arm. That's good for 3 years, and the main side effect is irregular bleeding. And for some people, it's bothersome enough they wind up getting it out. But a lot of people can tolerate it, and it often just goes away if you sort of hang in there with it. And then NuvaRing, which is a non-daily, that's a vaginal ring, that's monthly. And it's basically like a birth control pill, so if you didn't like the hormones of a birth control, you probably wouldn't like the NuvaRing, but if you were okay with the hormones, it's a good alternative. And I think that covered them all, except for Depo-Provera, which is a shot, which is at 12 weeks. Every 12 weeks, get another shot. Main side effect of that one tends to be weight gain. And the other thing that I've seen is it takes a long time to get out of your system. So keep that in mind as well. Okay, so let's see. Got a question popping up here. Currently on the pill, planning to conceive in May. Holiday in April. Want to skip a period. Should just down birth control in May. Yeah, so, you know, my advice is always just keep taking birth control pills until you're ready to conceive. So there's no evidence that there's any sort of delayed return to fertility with a birth control pill. Now, there definitely is delayed return to fertility with Depo-Provera. That stuff takes forever to get out of your system. But pills typically, if you when you stop them, you're good to go. So if you wanted to not take placebo pills during the vacation that you mentioned, then I would do that, skip the period, no problem, and then just stop taking the pills when you're ready to get pregnant the next month in May, and you'll have a period, and it might be a little bit irregular, but no big deal, and then just get to it, and good luck. There's a video on my channel about maximizing your natural fertility, so if you haven't seen that yet, check it out. It's on the playlist called, I think, Trying to Conceive, Infertility/Conceive. I think it's covered in there. That's a good video. It was actually, that was a good video, but no, what I mean to say is there's good information in that video. It was taken from a position paper from the American Society of Reproductive Medicine. So those are the fertility specialists, and basically they said, here's all the things you should tell your patients so they don't have to come see us, the fertility people. So check it out. It covers a lot of interesting things, I thought. I actually learned quite a few things from making that video, so hopefully you check it out. Hopefully you like it. Let's see. Keely's wondering, when on your 4th pregnancy and it's twins, how important is vaginal bed rest? I assume you mean like pelvic rest. So yeah, there's no evidence that intercourse is going to increase the risk of preterm birth in an otherwise uncomplicated twin pregnancy. Now, a different story completely if you have an incompetent cervix, if you have placenta previa, those are high risk situations where we're going to say definitely you should be on pelvic rest. But if everything's going okay and none of those are a problem, then really no restrictions. Hopefully that answers your question. If it didn't, let me know, but I think that's what you're asking me. Okay, let's see. Popping up over here on YouTube had a question. Let's see. 3 centimeter endometrioma. Any possibility of getting pregnant? Last 3 months, taking Danazol, 2 months. Is still there. Yeah, so, sorry, there we go. So it is quite possible that endometriosis can reduce your fertility, no question about it. It is definitely not 100% guaranteed that someone with an endometrioma is not going to get pregnant, but it definitely could contribute. So if I had a patient who had a known endometrioma, say by ultrasound, and was having a hard time getting pregnant, my advice would be consider surgery to drain that, clean up the endometriosis. There's decent evidence that in that situation, it may improve your chances of getting pregnant. So, that's a personal call as to when you pull the trigger on surgery, but, waiting 3 to 6 months certainly seems reasonable. Notice my dog chewing on something. But yeah, it definitely could play a role. It definitely could be part of the picture. Let's see, Brooklyn, is there anything safe to take for a cold or flu? Yeah, absolutely. And really important to plug to say, number one, get your flu shots, everybody. We still have them at the office, so if you haven't gotten one yet, get one. We'll be open on Monday. Come get one. We're trying to get everybody immunized, but if you haven't gotten yours yet, come see us. It doesn't matter if you're pregnant or not at this point. We've got enough to get for anybody. Number two, as far as medications, if you were suspected of having the flu, legit, like you had an exposure or you had symptoms consistent with the flu, high fever, shaking chills, sudden onset, feel like crap, you should be treated. And we use Tamiflu. It is safe in pregnancy. And I have a very low threshold for treating someone in pregnancy. I would not wait for a flu test. If someone had symptoms, had an exposure, I would treat them. But then if you're talking about more just like colds, not really the flu, then any of the over-the-counter, like Tylenol-based cold remedies are fine. You want to stay away from the non-steroidal medications that are like ibuprofen or naproxen because those can have some effects on fetal circulation in the heart. So any of the Tylenol-based cold-type medications are fine. And things like Robitussin and Mucinex, guaifenesin for cough, those are all fine. Let's see, I think I saw something pop up over here. Shuri says, a 3-year-old conceived IVF, ready for baby number 2. I've been reading about mini InfoCell IVF. So, number one, Sharice, I'm not a reproductive endocrinologist, so I'm a general OBGYN, so I do know a fair amount of things about infertility, but I'm not claiming to be an expert. I would definitely say if you've had IVF before, talk to your reproductive endocrinologist to get their opinion because they're definitely the expert in that situation. I'm just Googling it to see if I remember what InfoCell is. I think I know what it is, but I don't want to start talking about it and not really know. So that's the intravaginal thing, yeah. It's interesting. I'd say that there is very limited evidence at this time because it's fairly new. But the concept is that one of the crucial parts of in vitro is after the egg is fertilized, it has to be grown. It has to be grown typically in a lab for a few days until it's ready for transfer back to the uterus. And that's a critical time. Temperature management is extremely important, and to have a very nice steady temperature is critical for normal development. And this InfoCell thing is like an intravaginal, it's like a cup basically that they put the embryos in and seal them up and place it vaginally. And of course, vaginal temperature is perfectly constant and gets around some of the concerns about variations in pH and other things that might occur in the lab, because of course the human body's way better than the lab is. So I think in theory it's an interesting concept. I have no idea what it costs. I don't even know about availability. It's not available everywhere. There are centers in the U.S. and certainly abroad that are doing it, but I don't have good data on, say, comparison of pregnancy rates when you look at that versus sort of standard IVF. But it's a great question, and it's very interesting, and I think that there's probably a lot more to come on that in the future. All right, let's see. Ashley asked, what's a normal length of time for a couple to conceive? Well, the technical definition, of course, is if you've been trying for a year and you haven't gotten pregnant, then that's how you make the diagnosis of infertility. Um, I'd say that if you're otherwise healthy, that it's fairly common to be pregnant within 6 months, but it's not unusual or abnormal for it to take up to a year. So that kind of gives you a time frame to sort of hang your hat on, I guess. If you are getting out into that 1 year neighborhood, then my advice, check out the video on my YouTube channel. This talks about evaluation of fertility. I kind of run down all the basic stuff that we would do to check out a couple who are trying to get pregnant. Okay, Heather, let's see. Antigen E is the titer gets to 1 to 16. What happens as far as taking care of mom and baby? Okay, so there and this is, it gets deep really fast. So I'm going to give you the highlights, and I'm going to tell you that there is a video. There are actually 2 videos on my YouTube channel that talk about this. One has to do with the KEL antigen, and it's kind of funny. I explained it with donuts, and it sounds dumb, but it made a pretty good visual. So check that out. And then there's another one on there about the Rh factor, and they're very similar. So assuming that an antibody is against a clinically meaningful antigen, in which case like anti-E is, if you get to what is called a critical titer, which is in this case is 1 to 16, then you do have to start to monitor baby for signs of anemia. And the gist of it is basically what they're measuring is they're measuring the amount of antibodies present against that antigen. And if they are going up, then the titer goes up. And if you hit a critical titer, then you know that there's a potential for these antibodies to be present in sufficient quantities to essentially lead to destruction of fetal red blood cells and cause fetal anemia. So then you start to monitor for evidence of fetal anemia with ultrasound. And the way they do that is they look at the blood flow through the baby's brain. It's called the MCA, so middle cerebral artery, middle cerebral artery, let me say it right. And they look at the velocity, so how fast the red blood cells are going through there. And that gives you an idea of the level of anemia. And that's how it starts. And then if you develop anemia, then oftentimes babies have to have transfusions while moms are still pregnant. So they do intrauterine transfusions. And that is talked about somewhat in my video on that KEL antibody. And there's a relatively famous YouTube person out there who it's all on their channel. If you look back, the person's name is Sean Duras, and that's the husband. Jenny McBride's her name. I'm not saying anything that's not on the internet, so I'm not violating patient privacy. And they had that, and they actually chronicle it quite nicely on their YouTube channel. Their baby's about 6 months old now and is doing great. So if you want to see some more details about that from a personal perspective, from a patient perspective, you can check out their channel. They're super nice folks. Okay, let's see. Amber, how long after C-section would you need to wait to get your tubes removed, or could it be done at the C-section? Yes, it can, and that's when I would suggest it. Does removing tubes require any hormone replacement? No, it does not. And would you still get your period? Yes, you would. Well, that was a good set of questions. So basically the idea is, for sterilization, if you're having a C-section, no-brainer, go ahead and do it while you're there. You're already open. It's going to add like 5 minutes to the operation and is no big deal. The benefit of removing your tubes is we think that it probably reduces the risk of ovarian cancer. So it turns out that most ovarian cancer probably starts in the fallopian tubes. So if you're done with them, take them out. So that's what we're doing nowadays. And yeah, we do it at the C-section all the time. Let's see. Kelsey, how long after giving birth is it recommended to wait to do the round of IVF? Well, that's really the same question as how long should you wait between pregnancies to have another baby after one delivery until you try again for the next one. Generally speaking, most pregnancy outcomes look at delivery intervals of either 2 years or more or less than 2 years. And it does appear that there are some increased risk of certain types of complications if you have less than 2 years between deliveries. Now, having said that, it's not a huge deal. The risk is not tremendous, and I don't worry about it. If someone rolls in, and they've got a 6-month-old at home and they're pregnant again, I'm not going to freak out about that. But if someone asks me like, well, we're going to wait, we're going to do what, is supposedly the right thing, then I'd say, wait till your baby's about a year old before you start trying. Let's see. Mary says, when do you recommend getting hormone levels checked? Kind of open question there. So, the short answer is it depends. Um, it always depends. Um, but the gist of it is, in terms of checking hormones, say for menopause, if someone's having menopausal symptoms, hot flashes, night sweats, irregular periods, stuff like that, and we're trying to figure out are you menopausal or not, well, in that situation, checking certain hormone levels could be helpful. If you're not menopausal, there's not tremendous evidence that checking levels is of any particular benefit. Now, people do them when they're trying to do bioidentical hormone therapy. Say someone comes in feeling fatigued or having some menopausally type symptoms. It's not wrong to do that. I would just say that it's somewhat unencumbered by evidence. In other words, there's not great data that really backs up using levels in that situation to guide treatment. People do it, people are trying, they're just trying to help, but we just don't have tremendous data that really tells us what the right answer is in that situation. Okay, let's see. Emily, 38 weeks and 2 days, 3 centimeters, completely miserable. Anything you can do at home? Not really. I mean, you can try them all, but I'll just tell you now that none of them work. There is actually a video on my YouTube channel, which you're obviously well aware of because you're on it right now, that's called something like How to Start Labor at Home Naturally or something like that. And basically, it just kind of is a Mythbuster type video. So if you haven't seen it, check it out. Let me know what you think in the comments. I found it absolutely hilarious to make and had a good time making it. But check it out and let me know what you think. Okay, let's see. Corbin, is it safe to get an 80-minute massage while pregnant? Yes. They have a belly pillow, stomach and back, 7 months long. Yeah, I mean, you wouldn't want to be like flat on your back, particularly at like 28, 30 weeks. So even if you are laying on the bed, if you just have a little pelvic tilt, we call it, so you could just put a towel roll under one hip, so you just get a little bit of a roll in, then I think you're probably fine. Excuse me, but I wouldn't recommend being flat on your back for prolonged periods of time. If you have a baby that's sensitive, it might reduce blood flow and it could cause some issues. Probably not a very big risk in the grand scheme of life, but just have a little pelvic tilt and you should be fine. As far as being on your belly, I don't think that's any big deal, other than it might not be super comfortable. Let's see. Have a question. Is IVF your only way to get pregnant? You have low ovarian reserve and your partner's sperm count's low, mobility problems also. It's, definitely starting to sound like in your situation. I mean, if you have low ovarian reserve and you have low sperm quality or motility, the odds are stacking up not in your favor, unfortunately. But it doesn't mean you can't get pregnant on your own. You could. I think it just means that the chances are substantially lower. And, definitely in that situation, in vitro would help. I guess you could consider doing just artificial inseminations, which obviously doesn't address the ovarian reserve question, but at least it does something for the sperm maybe. Clearly in vitro is the best way to go. Obviously it's expensive, but it's like I always say, you get what you pay for. So I wish you good luck. Let's see. Tried all the old myths, just wanted to make sure. Yeah, no, good luck though. Let's see, Cassandra had second baby on Thursday. The only pain you're having is low back. Is that from the epidural? It could be from the epidural. You may get a little temporary soreness at the injection site. It would probably only last a few days. If it was Thursday, certainly could be. I wouldn't be concerned if it's not severe, if you don't have a fever, if you otherwise feel okay. It's probably nothing, and it probably goes away on its own. Now, whether or not it's from the epidural, you'll never really know. And definitely back pain is a very common complaint during pregnancy and even after delivery. The beds of the hospital are not the world's greatest. And I think not uncommon to have some back discomfort just from having a baby either way. But whether it was epidural related or not, should be self-limited and should go away all by itself. So wouldn't be worried if everything else is going okay. And congrats on having your baby on Thursday. I didn't have any Christmas babies. I was out of town, but I checked. I missed one delivery. It may have been on Christmas. I don't think it was. And I just delivered 2 today. So a couple people waited till I got back. So I appreciate that. Okay. Well, I think I'm all caught up on questions. Let me just check YouTube here and see. I think I got everybody. If I have not answered your question, it's because I did not see it. So if I haven't, just please copy and paste it and put it back in there, because I think I've seen everything. Let's see. I think I'm all caught up over here on the Facebook feed as well. I'm just going to refresh it to see, make sure I didn't miss anything. So if I didn't answer your question, just put it back in and let me try again, because sometimes it doesn't work. But it looks like I'm all caught up. Cool. Okay. Well, if you have other questions, post them and I'll answer them. Otherwise, let me see. I'm going to look back at YouTube for a minute at my recent video comments and just see. They often have good questions to other people. There was one recently talking about what can you do to select the gender, and there is a video on my channel that talks about how to have a boy or a girl, and the short answer is you can't control it except for with things like in vitro and pre-implantation genetics and sperm sorting, which is expensive too. But in terms of natural methods, none of those, like the Dole's method, they don't work. But it's a common question that I get all the time. Let's see, Brooklyn had a question here. After how many miscarriages do you monitor a pregnancy closer? The short answer is, or maybe I would change the question slightly. And so if someone said, when should I have an evaluation for recurrent miscarriage? After how many? And so, my typical answer is if you've had 2 in a row, and definitely if you've had 3 in a row. But 2 in a row is a reasonable place to consider checking things out. The best, of course, is to do this before you get pregnant with the next baby, because there's not a whole heck of a lot you can do once you're pregnant again. So I'm really talking about evaluation after, say, a second miscarriage. And there is a video on my YouTube channel that talks about evaluation of recurrent miscarriage. So I would recommend you check that out. I go through all the things that you check in detail, and it's kind of a longish video, so I won't go through all those points right now. But anyway, your question is, you're pregnant now, 8 weeks. So, typically what I would do in that situation is I would just see folks a little more frequently, honestly, just for reassurance, to kind of make sure everything's going okay. So the typical is, a monthly visit in the first trimester, and I would typically see folks every 2 weeks or so if you've had recurrent pregnancy loss. Like I said, once you're pregnant, there's not a whole lot you can really do other than just kind of watch closer and fingers crossed that everything goes okay this time. Let's see. Kaylin, is there a risk of induction at 39 weeks, like baby not getting hormones they should, say for time? Yeah, so, and the short answer is no. So 39 weeks and up, basically outcomes are the same. So there's no proven benefit to waiting beyond 39 weeks for the baby. Now, there's also no proven downside to waiting for the baby either. So there's really no downside either way as far as baby's concerned after you hit 39 weeks. Now, prior to 39 weeks, there definitely are higher risks of respiratory distress, temperature instability, feeding problems, all kinds of stuff. So that's why we would not do it prior to 39 weeks without a medical indication. Now, the interesting second question is there any risk or benefit of induction to the mom? And that was just recently answered with this trial called the ARRIVE trial. And we participated through McCady Hospital as part of the Maternal-Fetal Medicine Units Network. It's the National Institutes of Health here in the U.S. This is called an NICHD MFMU study, and it was called the ARRIVE trial. And 6,000 first-time moms were randomized to either being induced at 39 weeks or just wait until the baby came, or 41 weeks, whichever happened first. And the interesting thing was the C-section rate was lower in the induction group. So moms who were induced at 39 weeks had a substantially lower risk of induction, a lower risk of C-section, if they were induced, versus waiting till, say, 41 weeks when the C-section risk was higher. So there was a benefit for babies, the outcome was the same. The other benefit to moms was there was a lower risk of blood pressure related complications like preeclampsia, stuff like that. So check it out. There's a video on my YouTube channel called something like Should I Be Induced? So check that one out and see. I go through that in more detail. Let's see. Liza says, as preemie, first baby, 35 weeks. You were preemie yourself. What are the chances this happens for the second baby? It's an interesting question. There definitely is a higher risk of preterm birth in moms who've had a preterm birth. Now, what we don't know is what if you yourself were a preemie. The studies just don't go that far back in the past. So it's difficult enough to say compare people's pregnancies from one to the next, never mind from when they were born and all that kind of stuff. So it's just kind of hard to really know. It's hard to gather that kind of data. But what you would say is that you do have a higher risk than the average person based on your history of preterm birth. And then the question becomes, well, what can you do about that? And there are good studies that show that progesterone injections from about 14, 15, 16 weeks weekly, all the way to 30, I think the study went to 34 weeks, but I do them to 37, reduce the risk of recurrent preterm birth 15 to 20%, something like that. It's been a minute since I looked at that study. The risk reduction was substantial, and it's basically the best thing you can do at this point. The other thing that is recommended is to watch cervical length. Check that around mid-trimester, so 16 to 20 weeks, somewhere in that neighborhood. And if the cervix is getting shorter, there is evidence that placing a cervical cerclage or a stitch might reduce the risk. There's also evidence in other studies of cervix being treated with vaginal progesterone. So that's the other potential treatment you could do to reduce your risk if you're noted to have a short cervix. So those are the kind of things that you might check out, but good evidence on that one. So I would definitely look into that. Let's see if Diana says, if you have a retroverted uterus, is it hard to conceive? So yeah, retroverted uterus doesn't affect fertility rates at all. I always kind of say, I mean, it's got to be in there somewhere. Some are pointed back, some are pointed up. It really doesn't matter. So nothing that you need to worry about. Let's see, Kelsey said, woke up on Christmas with some swollen lymph nodes in her neck and throat and a stomach bug. Threw up all day, been better since, except for the lymph nodes can barely swallow. I mean, so I'm definitely not an ENT specialist, but if you're having persistently sore throat, let's say, and difficulty swallowing, because you said you can barely swallow, got to worry a little bit about like, well, something going on in your tonsils, maybe, you know, tonsillitis, or even in rare cases, peritonsillar abscess and things like that. So, you know, to me, if it's been several days and you're not getting better, and especially if it's getting worse, I would definitely get that checked out. The best advice, I think, would be to go to like an urgent care or the emergency room if you have no other option. But particularly if you're saying you're having a hard time swallowing, that's a bit concerning. And like I said, I'm not an expert on that particular topic, but it sounds like worth getting checked out to me. Let's see, Corbin, are air compression socks safe to use at home? Yes. Hope it'll help with swelling. Probably would. They're kind of like what they give you in the hospital. Yeah, absolutely. We use those exact type of things in the operating room to reduce the risk of blood clots in surgery. So absolutely, yeah, they're safe, they're fine, go for it. I actually have a pair myself for recovery after all the crazy triathlon stuff I do. Okay, something popped up over here. Let's see. Would it be wise to use DHA if your hormone levels are normal, AMH, reasonable recovery? Yeah, so the basic question is, what can you do to improve your egg quality? And unfortunately, the answer is nothing. There's no medication, there's nothing you can do that makes your egg quality better or worse for that matter. It just kind of is what it is. It is age related, of course. The interesting thing is that the AMH test that you mentioned actually is not predictive in terms of pregnancy rates for spontaneous conception, different from in vitro, completely different. I'm not talking about that. But if you're talking about just trying to get pregnant and, hey, this is my AMH, is it good, bad, or indifferent? It turns out it doesn't really matter. And I made a video about that on my channel that went through the data pretty recently. It's got a picture of like an egg timer on it. That's the thumbnail. I remember that one. So maybe check that out. But nothing wrong with taking DHA, certainly, but it's not going to improve egg quality. It's not going to help you or hurt you in that regard. Okay, so let's see. Any concern with progesterone injections? Yeah, no, there's really no evidence of any major downside whatsoever. You can get some minor injection site reactions. So if anybody's done progesterone shots, you'll know that they can be kind of irritating. So they mix the progesterone in oil so it can be injected. And the oil that they use at the pharmacies to make this stuff can be irritating. So they use sesame oil. There's a couple different things they can mix it in. So I always tell people, if you're having an injection site reaction, ask the pharmacist to switch up what they're mixing it in, and sometimes that helps. But in terms of like actual complications, no. There might be very slight increased risk of gestational diabetes with progesterone shots. There's a couple studies, small studies, that said maybe slight increased risk. But when you compare that to the morbidity and the risks for a premature baby, that's a no-brainer. So I don't even think twice about that. If you've had a preemie, we know that the risk of having another preemie is higher, and we also know that there's a subgroup of people who are going to have a preemie even earlier. So even though maybe you had a 35 or a 34 weeker your first time around, you might have a 32 weeker or a 28 weeker the next time around, and that's a big deal. So you want to do anything you can to reduce that risk. And so I think the progesterone shots are well worth it. Let's see, Megan, due in 3 weeks and everything hurts. Can you take something for the pain? Tylenol's fine. And simple things like massage is perfectly safe. Getting in a swimming pool, getting in not a hot tub, but a warm tub, like 98 degrees is fine. You just don't want to get into like a hot tub and like raise your core temperature. That might not be good for a baby. It's kind of like having a fever. But any of these kind of simple things are all fine. Ultimately, delivery will be the cure. It cures a lot of things. Let's see. Can a cyst stop you from getting pregnant? So, you were talking about that a minute ago. With one specific type of cyst, there is potential, and that's called an endometrioma. So if you have a cyst that's full of endometriotic fluid, we call that an endometrioma. And there are studies that show that endometriomas reduce fertility. So those are treated surgically a lot of the time to try to improve people's chances of getting pregnant. But otherwise, like a simple cyst, probably not a big deal. I know that sometimes the fertility people ask us to go in there and get a cyst if it's persistent, but I think that's more to do with the fact that they're just concerned that if they try to stimulate a patient, say for in vitro or with injectable fertility drugs, that maybe you're going to make that cyst bigger, maybe it's going to be a higher risk of twisting, that's called torsion, and maybe that interferes with pregnancy, but I wouldn't recommend like a small simple cyst that you worry about it. Now, I mean, if it's something big, then when I say big, like 8, 9, 10 centimeters, you might want to get that taken care of. But if you're talking 2, 3 centimeter simple cyst, I would be inclined to ignore that unless you're going through in vitro and they're concerned about it. Let's see. Are there risks for trying to conceive over age 39? Sure, but not a huge deal. So there's actually a video on this channel that you're watching right now called Is 35 Too Old to Get Pregnant? And the short answer is no, it's not. I just like the title. And 39 is really not tremendously different than 35. The main thing to understand about what we call advanced maternal age is the risk of what we call aneuploidy. And that is a fancy way of saying chromosomal abnormalities. And that's a fancy way of saying things like Down syndrome. So trisomy 21 is Down syndrome, and you have a higher risk of those type of chromosomal abnormalities, trisomies, when you are over 35. Now, they can happen to anybody, but if you look at the risk as the age goes up, the risk goes up. So that is the main risk that you run. There are slightly higher risks for other things like diabetes and preeclampsia and maybe preterm birth. That one's a little bit hard to tease out. But none of these to me are deal breakers, and I would never tell anybody who is 39 not to try by any means. I just think you have to be aware that the risks are maybe a little bit higher. Now, the good news is there's testing that you can do in the first trimester now that is non-invasive to assess the risk for the baby for things like Down syndrome, trisomy 13, trisomy 18, and sex chromosome abnormalities. And there's a lot of different names for that test, like Panorama and Maternity 21, and there's 3 or 4 others. But basically, they're all doing the same thing. They're sampling fetal DNA from the maternal circulation, which 10 years ago was like mind-blowing that was going to happen. But now it's like, no big deal. We just sample a little DNA from your blood, and we can tell you about the baby. So that's a pretty cool test. I talk about it in some detail in that YouTube video I was mentioning that's on this channel that you're watching right now. So maybe check that out. Let's see. What are the risks of pregnancy? What risks for pregnancy after a stroke? Probably the main risk of getting pregnant again after a stroke is higher risk of a stroke again, unfortunately. And it does depend to some extent on what type of stroke was it. So there's hemorrhagic strokes, there's thrombotic strokes, there's embolic strokes, there's all kinds of different types of things that it could be. But certainly if it was a stroke then you need to know, like, well, what kind was it? What was thought to be the cause? If it was thought to be clot related, so a thrombotic stroke, then being on blood thinners during pregnancy could reduce the risk. But definitely it's potentially a risk. Let's see. Kelsey, who do you refer to for counseling or meds? Does OB prescribe? Yeah, so we're more than happy and comfortable prescribing antidepressants for postpartum depression, anxiety, things like that. So certainly, Kelsey, if you're having symptoms, give us a call. I'll be there on Monday. I'm happy to see you if you're able to come in. But as far as like counseling goes, we do have one therapist in the office that I'm not sure what the days or the hours are that he works, but there is one available at our office, and there's certainly others in the community for counseling. And there's definitely evidence, talk therapy helps. I think just sometimes with postpartum depression, you kind of maybe want to get on medication only because you want to do everything you can to get better as fast as you can, because you're responsible for a human being out there, and so we don't want to wait and let things get worse. But yeah, give us a call. Office. Did I say tomorrow? Tomorrow's not Monday. Call us on Monday. If I said tomorrow, you know what I mean. Okay, let's see. Diana, if my period is 35 days, what's your ovulation? So typically ovulation occurs about 14 days prior to the onset of your period. So in your case, maybe around day 21. And if it's always the case, then you can pretty much count on that. Cervical mucus is actually one of the best ways to monitor for ovulation. And I talk about that in the video called something like Maximizing Your Natural Fertility. You can do ovulation predictor kits. They help mostly, I think, to kind of say, yep, I'm ovulating, good. But cervical mucus actually is the most predictive test, and that's free. So I talk about that some on that video I mentioned that's on this channel you're watching right now. So thanks, you guys. Thanks for everybody who's watching. Let's see. Mackenzie, does nausea really mean anything in pregnancy? Is baby still healthy, growing if you're not throwing up? Yeah, there's not tremendous evidence to really answer your question, is the short answer. Even like, why do people get nauseous in pregnancy? We don't really know. There's theories, of course, and they mostly revolve around levels of hormones like HCG, human chorionic gonadotropin. Penny, hey, and Coronado. I love Coronado, by the way. That's an awesome place. There's always that concern, like say you're super nauseous first trimester and all of a sudden you're not. That's a little scary. And we often see folks in the office just check and make sure everything's okay, because you worry a little bit about, well, okay, if you think it's a hormone thing and I've been nauseous and now like all of a sudden I'm not, does that mean my hormone levels are dropping, and does that mean something's wrong? Probably 9 times out of 10 everything's fine, but I definitely see people all the time for that exact complaint. And fortunately, most of the time everything's okay, but every now and then you do find somebody, so it's something to keep an eye on. But on the flip side, if you had somebody, man, I'm never pregnant. I'm never pregnant. I'm never nauseous when I'm pregnant. Great, that's just you. You're just lucky. Don't tell anybody because they'll hate you. It's common, but not everybody gets it. So if you're not nauseous and you never were, I wouldn't worry about that at all. Okay, so let's see. And Diana's watching from the Philippines. Okay, Diana, you win. Diana wins. Coronado's pretty good. Canada was pretty good. Philippines, some crazy how far this YouTube channel reaches. Let's see. 26 weeks. This is back over here on YouTube. 26 weeks pregnant. Have moderate lower abdominal pain for 2 days. Feels like constipation and gas, but not apparently. No bleeding. Baby still moving. Should you be concerned? Probably you're fine. The sort of the way that I think about abdominal pain in pregnancy goes like this. And I think this is kind of just big picture, sort of universally can apply this. And it goes like this. If you're not bleeding, if you don't have a fever, if you're not in labor, so you're not having pain coming and going like 5 minutes for an hour, and you don't have other symptoms that sound worrisome, like maybe a urinary tract infection, or could it be your gallbladder if it's like a right upper quadrant pain, then, and the baby's moving good, you're probably fine. We definitely do know that your GI tract slows down when you're pregnant. And so although it might not be straight up constipated, it could be just some pain from your GI tract. Excuse me. We also know that, the uterus is growing rapidly and it's stretching its own ligaments like the round ligament. Excuse me, I get the hiccups. And that causes discomfort. But not only that, all your internal organs are getting smashed by this rapidly growing uterus. So I think that any or all those things could be painful. So basically, if you kind of go through the list of things that I mentioned, you don't have any of those and your baby's moving good, then you're probably fine. But if it got worse, if you developed any new symptoms, I'd say it's worth getting checked out. Okay. Let's see. Oh, hey, Didi, what's up? I know Didi's in Texas. So welcome. Hope you had a good Christmas, Didi. And Penny in Coronado. Yeah, so we were just there not too long ago in Coronado area. For Oceanside, there's a Ironman 70.3 in April. So we'll be going back there in April for next year, 2019. Katie, let's see, 37 weeks pregnant and baby has slowed down movement. Is that normal? So kind of big picture about fetal movement, it's fairly common to hear people say towards the end of pregnancy, the last week or 2 or 3, that the baby's not moving as much as it used to. So my first question is always the same. Oh, baby's first Christmas, that's awesome. My first question is always the same. Can you feel 10 movements in 1 hour, one time per day? If you can feel 10 movements in an hour, one time per day, then that's kick counts. I think you're good. Now, if you can't feel 10 movements in an hour, you could give it 1 more hour, maybe have a snack, have something sweet to drink, whatever. But if you still can't feel 10 movements within that hour, the next hour, then my advice is just get checked out. Most of the time, everything is fine, but you don't want to risk it. It's a simple enough thing to just go to the office, have a non-stress test, or like on the weekend or whatever, go to labor and delivery. They can monitor the baby. It'll take 20 or 30 minutes. And assuming everything looks okay, then you got peace of mind that everything's okay. So basically, if you can get 10 movements in an hour one time per day, you're good. If you can't, I'd get checked out. Okay, let's see. I think that's it. Yeah, I think I'm all caught up. So we'll give us a few more minutes. We've been going for, good grief, already 55 minutes. It's crazy, 52 minutes, something like that. So if anybody has any last minute questions, feel free to put them in the chat. Let's see. Lori says, 35 in January, been trying to conceive for 11 months, no luck. So yeah, there is a video on the channel you're watching right now called Evaluation of Infertility, and I would definitely check it out. And I'll hit the big picture highlights. But my advice is go watch the video and make sure you've had all the things done that I'm going to talk about in that video. But the big picture is sperm, ovulation, and tubes. Those are your big 3. And I would definitely say checking all those things. So semen analysis, check the sperm. Ovulation, she says I have. Yep, check. Ovulation documentation with, and he says get your partner. I said check sperm. Ovulation, you can sort of more or less document that with ovulation predictor tests. I talked about cervical mucus. You can check a day 21 progesterone level. Those are all ways to more or less confirm that you're ovulatory. And then checking the tube. So hysterosalpingogram, that's an x-ray. There's some pictures of it. Maybe you've already had it. But on that video, it talks about it, shows some pictures. Basically, you're flushing out the tubes with some dye, and you're checking to make sure they're open. And interestingly, there is evidence that if you do that test, you tend to see a little bump in pregnancy rates afterwards. So maybe there's something to this whole flushing out the tubes. But she said, yep, done all those things, now what? At 35, the next most likely, and this is one other thing, are your periods painful? Tell us if your periods are painful. If your periods are painful, you got to think a little bit about endometriosis. If your periods are not painful at all, it doesn't mean you don't have endometriosis, but maybe it makes it a little bit less likely. But if you said, yeah, my periods are terrible, and if you threw in there intercourse is terribly painful, you got to think endo. Not wrong to consider diagnostic laparoscopy to go looking for endo, treating it. If you find it, maybe it helps. But, a lot of times there's no endo, And even if you have mild endometriosis, then it's not necessarily helpful to treat it surgically unless it's severe. In which case you're kind of in this unexplained infertility. Probably age plays a role. Not wrong to start thinking about more aggressive fertility treatments like in vitro maybe. Perhaps having a consult with your friendly local reproductive endocrinologist. And Dee Dee said I think you said you use Fertilidad for men and women. Is that like a supplement or something? Let me know. Let's see, 42 and a half years old and pregnant, 30 weeks, good for you, congrats. They want to do non-stress tests twice a week. Their friend who's even older doesn't do it, no complications. Yeah, so there is evidence that if you are 38 years of age or older, then the risk of stillbirth is higher. And so it is pretty standard to recommend non-stress testing from something like 32, 33 weeks, once or twice a week, just to make sure everything's okay. So I would definitely agree with that. I don't see any harm in doing a non-stress test, so I would recommend it. I think it's a good idea. Lindsay, is laser hair removal treatment on face safe during pregnancy? Yes. Wonder if it's fine. You can do it. There's no evidence that zapping laser hairs is going to do anything bad. So have at it. Okay. Well, give us a couple more minutes. See if anybody else has a question. Otherwise, we'll wrap it up. It's been a pretty good Facebook Saturday. I know you guys probably know I used to do them on Friday, but I was just too tired yesterday. Flew home on the red eye from Hawaii. Tomorrow's a ski day. Hopefully, one of anybody's local in Utah is going skiing tomorrow, but it looks like it's going to snow. So I think I'll be up there with my son hitting the slopes. So I think I'm all caught up over here. If you guys have any last minute questions, let me know. Otherwise, I think we'll call it a day. And thanks again to everybody who's been watching. Oh, here we go. Lori, I got an OPK last night. Should try again tonight. Yeah, so it's perfectly fine. I would try again today. The most pregnancies, let me rephrase that. The most fertile time is the 5 or so days leading up to ovulation. So, and I'll talk about that in that video, talking about how to improve your fertility naturally. So daily intercourse for the 5 or so days leading up to ovulation is the best. But if you had an OPK yesterday that was positive, I mean, hey, no harm in adding it up, trying again today. It won't hurt anything. But as you start to get a feel for when you're turning positive, then you really want to have intercourse in the 2 or 3 or 4 days prior to that. Because that basically, I think the concept is, the sperm are hanging around the tubes, kind of waiting on the egg to find its way in there. So they don't kind of cross paths and miss each other. All right. So let's see. Dee said, got pregnant 3 days prior to an OPK. Exactly, see, just like I was saying. Dee always knows. You guys, if I'm not here, just ask Dee because she always knows. Okay, well, I'm not seeing any other questions popping up. I'm going to refresh this Facebook feed just to make sure I'm not missing anything. So yeah, thanks again to everybody who's watched. And thanks to everybody who has asked questions, because I got nothing to say if you don't ask me a question. So it's been super fun. Hey, while you're watching, don't jump off yet. Know this one thing. I talked about it at the beginning, but probably most of you weren't here. It's winter time. We're having our inversions here in Utah. Fortunately, today is a good air quality day, but there's some crummy air coming. Limit your outdoor exposure if you're pregnant or if you're trying to get pregnant. And there's a new study that just came out, published through University of Utah, that said higher risk of miscarriage moms who were exposed to bad air. So for every 10 parts per billion of, I can't remember if it was nitric oxide or nitric dioxide. I think it was probably nitric oxide. For every 10 parts per billion, the rate of miscarriage was increased by 16% according to that study. So it's a big deal. You want to avoid being outdoors when the air is crummy if you're early pregnant, and if you're pregnant in general, because there's another study that talked about stillbirth risk, and that's on my YouTube channel. If you haven't seen it, check it out. They did discuss in the interview with the lead author from the U, one strategy beyond obviously not going outside when the air's bad, is that if you got to be outside, wearing N95 respirator, which is not just a surgical mask, it's like a special thing, you got to buy it. Probably can get them, I know you can get them on Amazon because you can get everything on Amazon. I think you can get them at Home Depot, places like that, because they use them for like nasty paints and stuff. But so that will filter out the particles that are the small particles that we're talking about. And it looks, more and more like it is a big deal. And it's kind of obvious that it's a big deal when you look outside and you see that stuff and you're breathing it. It can't be good for you. But we're just finding, more and more studies that link adverse pregnancy outcomes, stillbirth, miscarriage, who knows what else. Preterm birth, I think, was on there. I go through more detail in the video on my YouTube channel, but bottom line, guys, stay out of the air if it's bad. Fortunately, today is a good day. I just checked it before I came online, and things were low. All the bad stuff was low today, but I think the forecast is for things to get worse. No surprise. But I think there's a storm coming, so maybe a little bit low risk in the next few days. But keep an eye on that. Go to utahair.gov or something like that. There's a website. There's an app. You can get it on your app store or whatever, that you can check it for your county, so you can see county-specific data for all the Utah counties. Just keep it in mind, folks. And reduce things that make it worse. So not burning on burn days, reducing your trips in your car. If you're going to get a new car, think about an electric car. Those are all things you can do. When our snowblower dies, I'm getting an electric snowblower. But I gotta wait for this one to die because it cost a freaking arm and a leg. Let's see if anything else is popping up over here. I think we're good. I think everybody's good. So hey, thanks for everybody. Thanks for watching. Thanks for hanging on for that last little bit. Just check it out. The Deseret News website has a link to that study I was telling you about. If you're curious, you can Google it and read more about it. And I'll do a video. I'm just waiting for the article to come from the librarian at McKay to give me an online copy of it so I can read it in more detail. That's the bottom line. Thanks to everybody who's been watching. Hope you guys had a great Christmas. Happy New Year. Stay safe. And see you guys next time. Take care. Bye-bye.